Thanks so much for joining me back on Woman to Woman. I'm Deanne McCallum. We are talking natural healing today. Natural healing restores our body's ability to heal itself. Lee Royer is here, Dr. Nance MacLeod is here, and they're with the Southampton Wellness Center for Wellness. Right. And it's all about natural healing. We do have a call though, so we're going to go right to that and talk to Anne from Alcona. Hi, Anne.
Hello.
How are you tonight?
I'm fine, thank you. You?
Good. Very well. You have a question for Dr. Nance or Lee?
Yes, I was wondering, my mother has been diagnosed with Graves' disease, and she's had mass doses of prednisone, which has elevated her blood sugar. She's becoming drug-induced diabetic, and we were just wondering if there's anything that we can be giving her that would be better than the prednisone, something natural.
Without actually doing a physical on her, it'd be hard to tell you what we could replace that with, but I'm sure there is a number of things that you could use. Prednisone is so hard on the body and so hard on the liver. Off the top of my head, there could be some enzymes that she could be using, some probiotics she could be using. There could be some, I'm just trying to think, even St. John's wort could be beneficial. Latericine might be beneficial for her. So these are all just kind of supplements off the top of my head that I can think that might work for her. The best thing to do is actually find out what is working for her and what you can do. And with prednisone, you'd have to take her off gently, like slowly. You couldn't just do it cold turkey. So I would have to be working with the medical doctor when it comes to that. I've done that many times, especially with people with depression and whatnot. Medically induced diabetes is so common these days. It's very, very sad that we're pushing this on people. It's really diet. If you can get some diet, and how is she? Is she active at all? Can she do much at all?
No, not really, because she can't see. The pressure was it was pressing on her optic nerve, so she's just had to have surgery to release the pressure on her eyes. And this all started. She had a heart attack and a triple bypass, and the Graves has just started since then. Yes. So she's 78, and we're just trying to maybe do things more gentle than the medications. But
yeah, it's without actually working with her personally. It's hard for me to say do this, do that, and do that. But I totally understand it. It seems like once one thing happens, it just continues and continues and continues, and then the side effect from the medication just makes things worse. I can't even think of anything that I can just suggest off the top of my head.
It's pretty well a case of having her come and seeing us, and so we can work with her personally. We really need to just work with her personally and get to know her and have her go through the whole natural medicine physical with Nance and get her hooked up to the scan and then go from there.
Right.
Yeah, it's very, very sad. I do feel for you. It's hard going through that. Watching your mother go through that.
That's why I was wondering if that, I'm not sure what you called it, the foot bath, if something like that would help.
Yes, the ion foot cleanse,
That would be beneficial, that would help, but she would need more than just that. The ion cleanse is a great start to detox, but there could be other things that would need to be done. Now, you said she had a triple bypass or quadruple?
Triple 2 years ago.
2 years ago, And that's really when everything started to go. Yeah. That's unfortunate.
Yeah, it's been a long haul.
Yes, I feel for you. I really do. And definitely, if you can get her in, we can work with her. You can't just take her off of the prednisone cold turkey, though. It has to be done slowly.
Right.
So even if you're working with somebody else, just make sure it's done very slowly, and that they're working with the medical doctor and communicating.
Absolutely.
Okay.
Well, thank you.
Thank you.
Thanks so much for calling in, Anne.
Thank you. Bye-bye.
Bye.
Bye.
What is medically induced diabetes, and why would we do this to people?
Basically what happens is once you get on any, it's not all pharmaceuticals, but some pharmaceuticals will actually slow down and your pancreas, and then you become insulin resistant, and once you become insulin resistant, then you can't absorb your sugars, and then you just, the whole body gets out of balance.
That's incredible.
Unfortunately with pharmaceuticals, there's times that we need them,
yes.
but there's also times that they actually do more harm than good because of the side effects.
Now she's saying her mom had Graves' disease. What is that?
Graves' disease is
Graves. Okay.
Yeah, is usually a nerve, an issue with nerves. Again, electrotherapy might work with her, but we'd have to look at her and see what's going to happen with her.
Yeah, it sounds like she's been through so much.
Yes.
So definitely a visit with you guys.
Absolutely.
And hooked up to this machine. What else are we looking at here, Dr.
Actually,
Nance?
you're looking at a person's heart, and it's showing me that there is some hypertension happening, some blood. The blood pressure is a little high right here. You can see there's some blockages in the aorta. So that's telling me a lot of what's going on because, high blood pressure is what they call the silent killer.
Okay.
And because you feel fine, you don't notice, blood pressure could be way up. And when you actually take a look at the heart, you can see how things are going on. And then there's a number of things you can do naturally to prevent high blood pressure. You don't have to go on any kind of pharmaceutical for the rest of your life. Everything can be done nutritionally. If we give the body the nutrition it needs, the body will respond, the way it's supposed to respond.
And we're very hard on our bodies, but we can turn that around. It will respond.
Yeah.
There's an interesting case we just had recently where this person has had a headache for a long, long time. And it was just really what Nance found was it was just a case of dehydration. She wasn't drinking enough water.
Really?
And that is something that people don't even realize, that how important it is just to keep the body hydrated and drink your 8 to 10 glasses or more per day. And some people need more.
For sure. We hear about that a lot. We don't do it. Dr. Nance, Leroy are here tonight. Listen. We're going to do exactly what they say. We'll be back right after this. We are back with Woman to Woman. Leroy is here tonight. Dr. Nance MacLeod is with me tonight as well. And we're talking about natural healing ways, gentler, kinder ways to be kinder to our bodies. And we've been talking with Dr. Nance about this incredible technology that you have here. People just can come to you. You do this scan with them. It's this whole body scan. It's nothing invasive, though. You're just kind of sitting there. You've got your hands and your feet on these steel plates, and it just shows you everything. Now, the brain, that is so cool. It scans your brain too. So tell me what's going on with this brain here.
Well, basically with this brain here, you can see in the frontal lobes that there's some excitability happening. More than likely because they're just, they're not extremely dark or anything. This just means this person just actually had probably a cup of coffee. And you can see that it's excitability is happening right in both the areas it is. Also, that can show stress as well.
Okay.
But if within the last hour.
Yeah.
And, in some cases, that's exactly what it is. Other cases, it's not. And that's actually showing that they're under extreme stress, which we do to ourselves often.
For sure.
And without even realizing that we're putting ourselves under stress.
What other things could it show in the brain? Is it just the stress part of it?
No, it can also show, it also talk about how a person might talk about, make decisions with their emotions because of certain part of the brain being, reduced or excited, that kind of thing. It will also show me when somebody is extremely depressed and they're going through depression. So there's so much. I can go on and on about what it can show me.
That is just the most amazing technology ever.
Yeah, it really is. It's really. It adds to my physical so much because
I guess it would.
I could always tell what was going on. I might be able to tell certain things by doing the tongue reading and the eye reading, and having the conversation and going through the health history. But all this is just confirms things. Plus, it shows me things that I would never have found. I would never find compression in the spine. Yeah. I wouldn't find bone density issues just by looking at the tongue and the eyes and doing the regular physical. So this just adds everything onto it.